Hello, everyone. Today we're going to be talking about the Orlando Regional Medical Center and doing a little evaluation of it. This is going to be a slightly different format because we're going to be doing it live. I've researched it like just a tiny bit, but I wanted to kind of go through it with you and make it more of like a commentary thing, with the whole purpose of all of this being just to raise awareness of really crappy hospitals and health systems. Because most of the time, the people that know about how awful the health systems are the ones that are only the people that work inside of it, and they can't speak out because then they'll get fired, right? We all know that happens. So I don't work in any health system, so I can say whatever I would like and be the voice of some of you. So some people have sent me things anonymously that we'll talk about, and other things we'll look at, like TikTok. Nurse Nander has done a whole bunch over there. So we'll just kind of like dive in and see what's going on. Sorry, this is a tiny bit late. They just did the Johnny Depp verdict, and I've been oddly invested in that and I needed to watch it, so we did that. I'm going to be giving my thoughts on that whole situation in a members only live right after this one at 4:15. So if you are a member, stay around for that. If you want to become one, there's a link probably somewhere, where we just get extra my own more personal thoughts versus, like, I try to keep these fairly academic and unbiased. Alea, it's so funny. I'm a new employee there at Orlando Regional Medical Center. This might be interesting if you want to give me some. Don't tell me on here, but if you ever want to tell me anything privately, I will be happy to anonymously share information that definitely didn't come from you. But also, congrats on your new job. Rochelle, hello. I finally got to join a live chat. Nurse practitioner student here, doing homework now and waiting to watch. Well, hello and welcome. All right, so let's dive straight into this. Welcome, everyone. I appreciate you being here. So, the thing that first got me looking at this was I saw on TikTok, let me see if I can share my screen, was people talking about 40 nurses walking out of a healthcare system. And then I was like, well, why would they all do that at one time? Like, that usually has to have a pretty heavy something going on behind it. Well, as it turns out, and if you don't like any conversation about anyone harming themselves, this is where you should probably stop and just revisit us in a couple minutes. The hospital had been having short staffed. Now, I am not incredibly certain about like all the details because, like I said, I'm going to do these more on the fly. But basically, the hospital didn't have a great staffing situation, like many hospitals around the country. And in one of the units, there were so few staff floating around that a patient had actually broken a window with a bedside table, jumped out of the window, and passed away when he hit the ground. And no one like noticed for a little while. The hospital's priority never was the nurses after this event happened. No one came up to like offer, like, obviously that would be very traumatic, right? Especially consider if that was your patient. Like, that would just be, I can't even imagine. Or the people who had to then go and like code him on the ground. um the hospital, from what it sounds like, didn't do anything to try to make this any better. Like, oh, let me go provide support to this staff that was there. And but they did make sure it was a priority to patch up the window by like the end of the shift and clean up the spot, like burn the ground or something is what I heard, where the patient had fallen, and clean that up. And then obviously when people investigated, they were like, well, why, how did this even happen? The hospital made sure to safely staff the unit when they were under investigation. And then immediately, as soon as the investigators left, they went back to their horrific staffing ratios. Now, the staffing ratios, it sounds like that they were working with were like in the PCU. So that's the progressive care unit. It's like a in between a med surge and an ICU. The hospital itself will actually dictate what goes onto those units. I have worked on one, and my at my hospital, you could have stable vented patients, so patients that were on a ventilator breathing for them, but they were stable. Or you could have someone who was requiring like vitals every 50, like 30 minutes, and they were on a lot of drips. They were just like they needed a closer attention, and our ratios there were 2 to 3. You could have 2 to 3 depending on how sick the person was, maybe on a crazy day 4. And the hospital here was having 8, so they had 8 people, which seems, that's insane. And that was the unit that, after a lot of the nurses saw, hey, they're not treating anybody very well here, and they like no one did anything following up, like tried to reach out and say, hey, this might have been a traumatic event for you. They were staffing them 8 patients to one nurse at the PCU where the nurses walked out, and supposedly 40 of them walked out because they said, no, I'm not accepting that assignment. It is incredibly unsafe, which is always your right to do. And I would recommend always protecting your license at the cost of, having something horrific happen. And so they did. They walked out. The hospital apparently has been trying to say that it was abandonment. However, let me tell you, it is not patient abandonment if you've never accepted the patient assignment, right? So if you leave and you're like, hey, this is insane, I'm going to bounce, they cannot charge you with abandonment. They might try to tell you that it is abandonment, but do not listen to them. I know people are also going to ask about safe harbor. Safe harbor is something that people in nurses in Texas and New Mexico, they can contact. I think it's like a safe harbor helpline or something if they have an unsafe assignment and report the unsafe situation. That only exists in those 2 states. So that is the basic rundown of the situation. We're just going to dive a little bit deeper into it. We're going to look into some Reddit threads of people saying other things of what's going on in this hospital. We're going to see if you guys have any advice on how you would handle these situations. Obviously, and then if I have advice, I'll give it to you along the way, but mostly as an exploration. And then hopefully, when people Google this hospital, they will be able to see what your comments are, what we have found recently in this, because we cannot change the situation unless we make people aware of it, right? We need the people up at the top of the hospital to be feeling the repercussions because they're just like up there in their, I don't know, their glass mansions. And they are still buying new hospitals, this healthcare system. So it is part of Orlando Health, as far as I'm aware. And Orlando Health continues to expand and build new hospitals. And then they come out with other articles saying that they can't pay their nurses, and that they had to stop hiring travel nurses, which was leading to a lot of this problem, but because they're broke, because they had to, like, I even saw something where someone was claiming like, oh well, we're broke because we had to pay all these travel nurses to fill in our holes. And it's like, that's like literally your job to make sure that you have safe staffing, and now you're blaming the nurses for not having enough nurses. Like, that doesn't make any sense. DB says, all of this is eye opening for me as a student. Channels like yours are amazing to give insight to students like me getting into nursing during these crazy times. I'm very glad it's helpful. I appreciate you being here. And I always, like, with all of these, I always want to say, I'm not saying any of this to scare people out of becoming a nurse. I know a lot of people that follow me are nursing students, merely to, like you said, let you know that this exists so you can find what to avoid. And in most of the time, there are hospitals that are not like this, right? So the goal is just to find the ones that are a hot mess express and avoid them. TikTok has been surprisingly helpful with this. We've seen other things like Vanderbilt, where Redonda Vaught worked. Out of the fallout from that, Vanderbilt like cannot keep employees to save people's lives. But we know that overall, like, so kind of making the public aware of it does matter. Where you work really matters. Making sure, essentially, it just comes down to taking jobs that make you feel safe. They are out there, I promise, but the goal is never to scare you here. If these do scare you, then leave. Like, honestly, do not, when you're in school or just in life, if any content makes you more uncomfortable, like leaves you feeling panicked, leave it. Okay. My entire like all of social media is essentially crocheting, right? Crocheting and flowers and plants. And then Alyssa all day has chickens right now. So I'm very invested in her having chickens. Like, follow things that bring you joy. Okay. If that means not watching me freak out about the whole world, that is very much okay. So let's look at, let me see if I can do this. Let's see if I can. We're going over here. I've just had a lot of coffee, so you might notice that I'm singing through my life. Okay, so the very first thing I wanted to show you was Nurse Nander. She is listed down below. Her TikTok is awesome. She is where I got a lot of this information, so go follow her. Let me see. She's done a couple rundowns on it. If you are looking for a job in the Orlando area, she does a really...
Yeah, I have more tea for you on Orlando Regional Medical Center.
Oh, I clicked the wrong button. Anyway, this one. This one has also, let me know if you could hear the audio because I want it to be able to share audio too. So let me know in the comments if you could hear the audio. She goes through all of the different hospitals in Orlando that have um like where you would want to work based on what type of nurse you are, which I found wildly helpful. So oh my goodness, my computer is having a moment. She has a health wealth of information regarding all of this. I kind of summarized it, so if you want to go in and look at some of these other ones you can, but pretty much my summary comes from her. So Nurse Nander, you to bomb, and I appreciate you. Let us look really quick. I, Alea says it is bad everywhere in Florida. um, yeah, I've heard. So I have practiced only in Michigan, and we used to joke. It was a joke that if like I practice as a nurse in Michigan, and even in Michigan, I guess because a lot of people lived in Florida, it was like a joke that um, basically if you got care in Florida, like um, you would go and do that if you didn't value your life or something along those lines. You know what I mean? Like if you weren't feeling super great about everything, you just go get taken care of in Florida and they'll kill you real quick. It's fine. I'm sure it's not like that everywhere. I'm sure it's not. But Florida does have an odd reputation for being awful. If you work somewhere in Florida and you love it and it's super safe and wonderful, please do, by all means, let me know. Moon Fairy, nursing student, I'm glad it's eye opening. I also hope the end of your semester is either done or almost done. Um, Beck Daniel said, so weird they can't pay us, but profit copious amounts yearly. Like, who are you trying to fool here? Exactly. I actually pulled up, I don't have their most recent data when I was researching real quick. I don't have the most recent data on what their income was, but they did. Is this where we had it? Um, the Orlando Health. They make, so the CEO makes 3.4 million. The chief operating officer makes 1.8 million. So this is obviously 2020, but I would imagine the numbers are still pretty much looking like this, right? So we come down, where is there, do they list their chief nursing officer? I don't see their chief nursing officer. They don't, must not count a nurse, chief nursing officer, as a key employee. That's not even remotely shocking to me. But this place makes a lot of money. From what everyone was saying, is they are like slowly taking over Florida. So my geography of Florida, not solid, but it sounds like so Orlando and Tampa are not neighbors, from what the chatter seems to be, and they are trying to take over Tampa. So if that means something to you, wonderful. To me, it means if you are still building a new building in this one complex you have, because they're constructing a new medical plaza, and they are not stopping, and you're trying to expand into other areas, seems to me like maybe you shouldn't. So here they were talking about, they started this construction for a new patient tower, and they are going along with it. They did get a grant, so part of it will be from that, which is also always helpful to know. But they're making what are they doing? They're renovating the women's center, so for having the babies. That's always good. More postpartum and labor and delivery. Gonna have a whole bunch more jobs, which is going to be interesting. Hospital positions. I wonder how many of those will be like nursing and if anyone will actually take them. And yeah, because the staffing ratios have been pretty abysmal. Let me see if I can find, let's go to Reddit. Shall we hop over to Reddit and see what the ratios were, because it was pretty appalling. So, in case you're unfamiliar, a normal nursing ratio on a med surge floor is like one nurse for 4 to 5 patients. Ideally, I know in a lot of places it's like 6 to 8 patients. This hospital, I want to say they were doing 12, which is legitimately impossible. I saw reports of someone going, I think Nurse Nander covered this on her Facebook page or her TikTok, where like if you have 12 patients, you're like getting a report in front of them probably, and then when they went back to check on the patient at midnight, they had passed away. And they had no idea because that was the first time they had had a chance to go back in the room. So even if you're not a healthcare person who's like really angry because it just gives me such anxiety even thinking about this, having to take care of this many people. This could be your loved ones. This could be literally anyone's loved one. And this is why this is so important, because you cannot provide safe patient care if your nursing ratios are doing this garbage. Okay. Helix Chaga said, per Florida law, nurses can be staffed 1 to 40 in nursing homes. That doesn't shock me. I bet they go even higher in all reality. When I covered the case about long term care, I will try to leave that link down below. But Christine Gainey's case, hers was 1 to, I think, 37 or 39. And I got tons of messages from people saying when they worked in long term care, their nursing ratios were 1 to 60. So, and then everyone just covers it up. Like, you know what I mean? It all just gets covered up. So that's why I'm talking about it. And if you ever have stories that you want me to share and talk about kind of in like a way like this, I am more than happy to. They can't do it. Like my job can't fire me because my job is in the education sphere. And then I work for, like, the other half is myself. And I promise at least most days that I try to keep myself from firing myself. Every now and then lately, I've been like, is this what I want to do? I don't really know. But most of the time I do try to keep myself employed. Let's see. Yeah, it's legal. I was straight up told not to be happy or complain when I was handed a 1 to 25 assignment because it wasn't the full 40. And this is something hospitals do a lot is, well, it could be worse. It could be this. So we're not going to fall for that. We're going to, I mean, you can't really do anything in long-term care because it's not over the limit, but everywhere else. And if it ever comes across a ballot that you can vote on or in any way support, mandated ratios. Obviously, we need to lower the ratios. We need Medicare to mandate lower ratios because Medicare is always a huge payer. Medicaid, and Medicare services. It'll also be called CMS, Center for Medicare and Medicaid Services. That is the people who we need to make. They're at the root of everything, right? They are who JCO reports to. They are like, that's the Joint Commission. They are who is at the bottom of this pyramid thing. They decide everything, right? They decide what is going to be illegal. They decide how quickly you can be readmitted to the hospital. They decide all the things. So we need to pass nationally, or at least in every state, a mandated ratio so that things like this can't happen. Angela Davidson, I said I almost took a travel position there when I was traveling. Glad I didn't now. Yeah. And apparently, Orlando Regional Medical Center used to be a good hospital per Nurse Nander. Again, go follow her. Great information. I believe she lives there and might have even worked there. She said that used to be a great hospital, but recently the staffing has fallen apart and they therefore their working there has fallen apart. But definitely go check out her TikTok if you do live in that area or you want to travel there and she has like a guide to it, which I thought was a really clever idea. And I was like, I wish everyone did this and did like because you always know your hospitals in the area, right? You're like, definitely go here. Do not go there. Don't go there. This is fine. This unit at this hospital is fine. Do not go over here. We all know those things. And we should somehow put together a database. If any of you are good with computers and a database, shall we take a peek at this Reddit forum? So this says, saw this on TikTok and wanted to see if anyone worked there. And this is a Nurse Nander thing, a link to it, or had firsthand experience. Basically, the PCU was dangerously understaffed, 1 to 8. Remember, we talked about in a PCU or a progressive care unit, usually you should be 1 to 2, maybe 3, maybe 4, depending on the acuity, but never 8. A patient jumped out of the window. They did not survive. The nurses were so swamped that no one noticed. The state came in and they got rid of the evidence of incident and emergently brought in more staff for the appearance of being staffed appropriately. And then they quickly got rid of that ratio. And then it was the next week that the nurses walked out. And that was after they were handed the 1 to 8 assignment because they were saying, look at what happened literally last week was someone died because of this. And now you're pulling this and that's not cool. Okay, good. So as a nurse who works for that hospital, that is all true. PCU was going 1 to 8, med surg 1 to 12. And the patient did jump out the window. You know, what's even sadder is when I was looking into this, I Googled patient jump out window of hospital, Florida, because I'm not the best at Googling things. And so many things came up. So many things. I was like, how is this happening so often? But anyway, Oh my gosh, how is this even allowed? Right? WTF, why isn't this national news? This needs to be brought up on a local news station. So, the reason that this doesn't get brought up on national news sites is because the hospital obviously does not want this broadcast, right? The hospital has no interest in this coming out that they're not staffing safely. They're making millions of dollars and it's going to affect their business, right? People are going to be like, I'm not going to go to that hospital. Nurses and other staff are going to be like, I don't want to work at that hospital. So they will do everything. They'll replace the window immediately. They'll make sure to clean up the site where horrible things happen. They will pay families off, as we've talked about so many different times with so many different cases. They'll just pay the families off of all the people who are dying, and people are dying because they're not getting the care they need because the nurses are so stretched thin. They'll just pay them off, and they'll be like, "Oh, it costs a lot of money to sue a hospital." A lot of money. And if you lose, then you have to pay the hospital's attorney fees. So most people, when they're offered hundreds of thousands of dollars or whatever it is, they'll settle and nothing. And then they also have to sign an NDA when that happens and nothing comes forward. People that work in the hospitals, their hands are tied because they can't say anything, right? Because then they'll get fired. And this is their livelihood. And even though the hospital sucks, it's still the way they make their money, right? So they can't just come out here and tell you things like I can because they fear getting fired by their employer. I've seen on TikTok people like reporters want to cover this. They've had a few one travel nurse, it looked like, was willing to come on TikTok and kind of talk about it, but didn't want to be, it looked like, interviewed, which I understand because then that could get back, like her travel network might end up firing her. So that's why it's not national news. And that's why I'm doing these because I want to out it. I purposefully tried to make the search engine, like you can kind of do SEO, like search engine optimization for like, where will this video show up? And I'm not very good at it. I tried to make it show up when you search the actual hospital so that people who would be looking like, oh, is this a good hospital to like work at or just Google it, that my video would show up. So share with all your friends, make them watch it, and then Google will think it's better and it'll promote it more. And I want to do this on a bunch of different hospitals and share any of your stories that you have because remember, I can't really uh, they can't come after me for telling the truth. We just have to stick to the truth or say things are alleged. So I'll just say the word alleged 12 times. And I hope that's how it works. I don't really know. I should probably get a lawyer. Go talk to my law tube friends that I've made over there. Nerd. Okay, is this the same person that was commenting up here? Yes. So this is the person that works there. I work in the ICU, and ICU should be 1 to 2 as a ratio. 1 to 3 in dire straits. Dire. But think about it. If you have 4 patients, this person's saying I worked in the ICU and we would be 1 to 4 frequently. If you have 4 people that need at least every hour vital signs that are all intubated, right? Because if you're in the ICU at a big medical center like this, they're probably all intubated. They're all intubated. They're all on a bajillion drips trying to manage their blood pressure. Those need to be adjusted all the time based on the labs you're constantly getting back and you're constantly drawing. And you're managing all of their drains. You're managing their pain. You're doing your neuro assessments, making sure they're fine. You're trying to reposition them. You're changing them because they're soiling themselves. You're doing and you're like, that's all if they all stay healthy. Heaven forbid one of them all of a sudden does poorly. You're going to forget about the other 3. Other nurses walking by are maybe going to have time to help you, but probably not because everyone else has 4 patients. They might do something to that patient that was actually not like that they accidentally harmed the patient trying to help you because, all the alarms are going off, but your other patient's dying. Are you getting the picture of like why this is a catastrophe? This is not safe. And they're hiring, the thing that makes me the most frustrated about all of this is they're hiring new grad nurses into these settings. And this is where you're learning. And this is not normal. Find a unit that's not going to be like this because this is not normal. It can be better. It's always been rough. But I'm telling you, I worked at a unionized hospital that had mandated ratios through the union. And it was really, really rough. We had very high acuity patients, but I very rarely, a few times, it wasn't good. I very, very rarely felt like I was imminently like terrified. You know what I mean? That it was like so much that that I was just going to drown and not be able to take care of everyone. I usually had one resource person I could go to. There was a lot of unsafe things that happened at my job. I was in charge I think I had been there 3 months and I was the most senior person some nights and I was in charge. That's never okay. But I never felt like panic like these people must have. All 8 intubated and crashing. Oh my gosh. I remember working in a night, 8 ICU nurses with 2 nurses for that side. No tech. So no one to help you with dressing, no one to help you with like emptying drains, turning, changing them when they're soiled, getting any of the vitals, doing no help. Charge is staffing. So usually when you're a charge nurse, um, on the units I worked on, well, one unit I worked on in peds, if you were in charge, you did not have to take patients because you were like helping everyone else. You were managing things. You were taking the admission. You were just like handling all the business. On the other floor I worked at, you did, but you took less patients usually. So here it sounds like charge is probably taking as many patients. All 8 were intubated and crashing. The PACU, which is the post anesthesia care unit, which is where you go after the OR, tried calling report for patient number 8 saying, well, the patient is getting billed by the minute. So when you're in like a acute care setting like the OR, or like a short-term setting like the OR or the PACU, you are billed rather than by the day, which is how normal hospital beds work, by the minute. And I said that sounds like a patient problem. um, Sounds like a healthcare problem. Why are we a different thing for a different day. I'm here with a newer ICU nurse. 7 patients, no tech, charge of staffing. PACU called the hospital administrator, brought the patient up, crashing and burning. So like the patient was, when you come out of surgery, a lot of the time, especially if you're heading right to the ICU, there's a lot going on. They're they're not stable, right? This person's going to require an hour or two at least of getting everything set up, getting everything like equalized. Their blood pressure is probably all over the place. Their breathing is probably wacky. They're in pain. Their drains are like everywhere because no shade, but mild shade to the OR. Kind of just come up and like all of their IVs are in this like weird cornucopia knot. Um, and it's a mess. So, other thing, little tidbit in here, I worked on a unit where we did get a lot of PACU admits. So they would come straight up from the OR. Make sure that PACU nurse stays with you until they're breathing. I have had PACU nurses drop off my patients. They were blue, their oxygen was in the 30s, and they were just like trying to waltz out while the person's respiratory rate was 3. And I was like, friend, no, come back. You have to at least stay with me until we figure this breathing thing out. We really know this patient is fine. So always, and PACU's always going to try to bounce, especially at the end of the day. No, I know you, I like PACU, you do great things. Every unit has their thing. And I get it. It's the end of your day. But just a little tip for nurses who are younger is stand your ground and don't let PACU leave until you actually feel comfortable and that patient seems safe. And so they brought the patient up. Patient had to be emergently brought to the CT and back to the unit while one nurse had 7 patients because you have to accompany the patient down to CT. So that's bad. That's not good. I don't like anything on that. Let me see. Did it just freeze or is that on my end? I hope it didn't freeze because I just popped over to the page. And let me know if it's still frozen. Matthew Wiley said my local hospital hires almost only new grads. I did a job fair tour and only 11 nurses and 1 seasoned and the rest were new. I ran out of there in the ICU. Crazy scary. Yes. I have worked on a unit, like I said, where I was the charge nurse and the most senior person there at nighttime on a med surg floor where we all had our hospital was, we took we were like this hospital, the Orlando one, where we were the big one in the area. So we took the sickest of the sick. So you could have like 5 people who none of them could get on the bed. And they were like running insulin drips and doing all of these types of things on 5 people who were all confused and needed help. And you had no sitters or techs. And yeah, it was all new people. And so that's a red flag. Good. I'm glad you caught your red flag, Matthew. If you go to a job interview and everyone looks very new, ask about the turnover rate. Be like, do people like generally stay here? And if they're like, well, we are a really great launching pad. Those are not words that you want to hear. That means no one stays and it's the worst. Jeremiah Rosa said, not frozen. Wonderful. Kelly said, that's my hospital, all new grads. I had a charge nurse who had only been out of school for 1 year on med surg. Yeah, I'd been out of school for 3 months when I was charged. And I was the first night that I was charged by myself. Someone else's patient coded. I'd been in codes before. People coded all the time on our floor. Probably a warning sign. Something else you should ask in an interview. How many rapid responses and codes do you have? Probably means things are that the nurses are so like codes happen. not always, but most codes and most rapid responses happen because you didn't see the signs earlier because people are so overwhelmed. If you see the signs earlier, you can intervene earlier, or you could at least make it a rapid response instead of a code. So if they have a lot of codes, it means people are not seeing the warning signs, probably because they aren't in the room enough. Like they might not have enough time. Anyway, um, 3 months old nurse, baby nurse, in charge. Someone codes. I was the most senior person on the unit. Ran to the unit next door, hysterical, like just ran over. I said, I need help. Someone please come help me. And brought someone else from the unit next door over who knew what they were doing. Thank goodness for them. Um, thank goodness for them. So always ask for help, just always ask for help. I gypsy and stop. I start nursing school in the fall. Find a unit that supports you. Find a hospital that doesn't teach you like this. I'm really, really hopeful that as we're making this more known, that as we're talking about all of this stuff more, that we will have people who will, they're not, a lot of people are not standing for it. Like people are starting to talk about it more. I hope that people keep talking about this stuff more. We keep sharing how to navigate it, teaching people like, don't take jobs if they're like this. Hey, don't, if you are in a job like this, like refuse, you know what I mean, like what to do in these situations to help make things safer. Consider helping your hospital unionize. They're going to treat that like that's the devil word, but if you live in a state that does not have mandated patient ratios, unionizing can be a really good answer to that. The hospital's going to swear to you up and down that unionizing is going to ruin the entire world, and that's because they're going to have to actually treat people like human beings, and that's going to really cut into their yacht fund, and they're not going to like that. So if your hospital is going on a tirade about, oh my gosh, like unions are the devil, no sir, you are the devil, and you just don't want to pay people. I'm sure not all CEOs are the devil, but just feels like that sometimes, of hospitals at least. So yes, Beck Daniel, good hospitals do exist. Great managers, coworkers, ratios are totally real. You just have to find the right place for you. And yes, 1,000 times yes. I worked my first job, as you probably guessed, was a little bit terrifying and awful. My second job though was great. Like I said, we worked at a union hospital. I worked in peds. I loved it. The staff was like, they were fairly supportive. You weren't, if you really felt like something was unsafe, they were receptive to that. Was it perfect? No. But I never ever felt any of the terror that like this seems to be. So there are good ones out there. You just might have to pick. And I cannot promise you that there will be like good ones necessarily where you live. Okay. So, but we're talking about this so that because I had no idea. When I went into nursing, I was like, of course the hospital is going to be safe. Like, I had zero idea that hospitals would, like, I didn't even ask about that in my interview. Like, can you make me a charge nurse? Didn't even ask because it didn't even occur to me. I was like, they certainly would not put me in charge of like other nurses when I'm a baby. And, now So we're just talking about this to raise awareness of all of this. Starseed Kitty, thank you for sharing awareness on this. I'm looking for where I'm going to work when I graduate. I will be done in 2025. You are really planning ahead. That's awesome. Congrats one day on your graduation. Like I said, I hope TikTok keeps, people keep sharing on here. Because like Nurse Nander did it. She did like a orientation to the hospitals in the area. I would love to see more people do that. Like, hey, I have worked, these are places I would work. These are places I would not work, and kind of go from there. And we can have like a little bit of a tour, right? That sounds fun. All right, let's see what else, if anything, we have. I'm going to have to bounce in 10 minutes, like I said, to go to, I'm doing a members only live stream about the Johnny Depp case and my personal feelings on it. So I've done one about how mental health was abused and stigmatized like no other. Had a lot of feelings in it. If you want to watch that, go check it out. I hate forensic psychiatry. That's what I've learned through all of this. And then I have my more just like my feelings of it. And it'll be over there. That's where I do like more of like my opinions that are not necessarily educational, but just filled with emotions. So if you want to go check out that, go over there. And Kimberly said 6 more months until I'm done with my BSN. Yay! I'm already wanting to find a job out of bedside. No shade with that. Everyone kind of thinks like, oh, like of course I'm going to find a job in like the hospital because I feel like that's the narrative that people sell. but you can find a job wherever. There's so many different options. Nursing has a ton of different options. Um, let me see. Oh, this is interesting. Okay. Oh, and this is why this post, it looks like, is going to highlight for us why no one knows about this type of stuff. I was recently fired from an Orlando Health. So, Orlando Health is the parent company of Orlando Regional Medical Center. So, it might not have been that exact hospital, but it's the overlying health group that it's in. I was recently fired from an Orlando Health emergency department for violating their social media policy when I told social media that we only had two nurses for a 32-bed overnight emergency department. Two? Oh, that's not good. That's really not good. So they must have gone on social media and said that, hey, there's two of us for 32 patients. I've never worked in the emergency room, but I would imagine your ratios would be depending on, in the ERs, there's usually different areas. Like if you're in the trauma bay, you probably have one patient, I hope. If you are on the like less sick side, like people who come in for like ear infections and stuff, probably have like 4 to 6. Someone who works in the ER, let me know. I have no idea about your staffing, but I would guarantee it's probably not 1 to 16. That seems horrifying. We'd been telling admin for months that we're short staffed. We only had 6 staff nurses for overnight, including travelers, like to rotate every day, not 6 at a time, but like 6 period. Oh my gosh. Right. So 6, that would never be enough, right? Because especially if you're working 12-hour shifts, then you would have 3 days of 2 nurses a night, which isn't enough, plus 1 extra. That's never enough. So if every single one of them was there, we would still be understaffed. Okay, good. I'm glad I did. I was like, was that math right? Every floor um, every floor was understaffed. The ER was basically a holding floor with nurses managing ICU patients. Which, remember, the ratios for ICU is supposed to be 1 to 2 instead of 1 to 16, in addition to whatever came through the door. 6 to 1 in some cases, high acuity patients. Admin says, you're going to have to make it work. So I told Central Florida about how unsafe the hospital was, and they sent me home. Talk about staffing problem getting home, and fired me via voicemail a day later. Yay, Orlando Health. Look at you being the worst. Oh, and then they link to trying to get the word out about this corruption by talking about it on my podcast with anyone who's willing to share their story. Tyndall's Razor. Let's click this. I realize I probably shouldn't click on links while I'm live because you never know where that's going to lead. Should we listen? Oh, no, I don't want to listen on Spotify. I wanted to show this person's YouTube. Justin Tyndall. I feel like we should evacuate because I don't know if YouTube's going to let me have that image. Okay, Justin Tyndall, if you want to find more, he's on YouTube. Let me see. Oh, and due to, this is just getting worse. And due to low staff, so things sound like a really big hot mess. And then if you talk about it, the hospital fires you, of course. And due to low staffing and poor safety procedures, Health Central Hospital, which is I think another university or Orlando Health Hospital, maybe, has several psych patients elope, which is eloping is just when you leave without like, I don't want to say permission. When someone runs away when they shouldn't, and either run into the street and get hit by cars or be harmed, like die later. Oh, one patient was Baker. They wanted to get hit by a car. Oh my gosh. So there's not enough people to keep people safe. And then this person saying, would you mind emailing the reporter? Also worked for the Orlando Health Emergency Department until 2020. And even before COVID hit, we were dangerously understaffed. More often than not, holding several ICU patients I'm assuming in the emergency room and a waiting room full of people through the night. On more than one occasion, staffing was so bad that staff were begged and guilted into staying past their shift until day shifts came on at 7. And on more than one occasion, a charge was taking a large team of patients. Oh, and we also had staff being pulled to cover freestanding emergency departments despite us already being short. Straw that broke the camel's back for me was in March 2020 when they told us we couldn't wear masks outside and the patient's room because patients' guest perception was more important than the safety of their staff. I remember that. Remember when you couldn't wear masks in hospital because they were like, oh, it's going to scare people. There was something to be scared of. Duh, duh. Ugh. Well, this is horrible. I work in their pool department. So their pool department, um, not a real pool. This is like your central staffing resource where people can like float, right? And to different units to kind of like fill holes. Worked in their pool department, and this is 100% true. I got sent to the med surge floor, and they tried to give me 1 to 8. And the med surge nurses there told me that 2 days prior she had a 1 to 20 because everyone quit. So she had to manage the whole floor. Also, administration now goes to every floor and counts the number of nurses there just to make sure there wasn't an extra nurse. Sometimes people come in to help out, and administrator wants to know that they continue to push the ratios there. It's toxic. Okay, so we learned today that don't work at this hospital. Do not work at Orlando Regional Medical Center. Um, this is how much are they getting paid? Probably $22 an hour plus one pizza party a year. Goodness. And then some more reporters saying that they want to cover it. Their policies have changed drastically over the last year. Because, like I said, I think it used to be okay. They tiered and capped everyone. So, what that means is the model of management is abusive. Even though they're in Orlando, they're trying to buy out the Tampa market. There's a lot going on. So what that means, tiered and capped, is basically like the nurses are put into, based on how much experience they have, you're put into a tier, and you have to do certain things in order to climb the ladder to be able to make more money. And a lot of it is going to be, I mean, some places pay you. My hospital didn't really pay you because you had to like volunteer to be on committees that then you didn't really get paid for because you had to come in on, like, it was just a mess. To get paid more, and then capping pay at like, hey, if you're still just a level B, you can't make any more than this much an hour. Whereas before it was like, you could just kind of keep getting raises. At some point in tiered and capped places, you can't. And my hospital was tiered and capped. That was part of our bargaining agreement with the union. However, we got paid very well. So we got paid more than everyone else in the area. So no one really complained about it, which is something your unit can fight for you. Let me see one more comment. I've heard they've had nurses sign an NDA, so a non-disclosure agreement, to keep things hush hush. This person is saying that, interesting, that they weren't sure that would work because you need like 2 people on it or whatever. Okay, well, that was very enlightening and mildly terrifying. Um, Yikes. Okay, so let's go over this real quick, and then I am going to hop off. Rick says in Florida it's like 27 an hour to start. The hospital across the street starts at 10% higher. So don't work at Orlando Regional Medical Center. You can go across the street to that hospital and make 10% more. So go there. Yeah, DB says especially not Reddit links. Yeah, I will learn. I will not clink random internet links again. We weren't burned today, but as I was doing that, I was like, this could be very, very bad. Ingy and Stop said, how do you advocate yourself as a baby nurse? So some of the things you're going to want to practice are just limits that you want to set. So like, I don't feel safe taking more than this many patients, and like, just put your, like, it's going to be really uncomfortable, but like, try putting your foot down, taking yourself, and practice what you're going to say beforehand. Because in the moment, you're just going to want to like poop yourself. You're not going to want to like come out here and be like, look at me, I'm so confident. Like, because you won't be confident because you're new. It takes a long time to get the confidence and the balls to be like, hey, like, I'm not doing this. Like, just stop. So practice what you're going to say beforehand so that it kind of just falls out of your mouth. And you can either, like, the first thing, the best thing is to avoid getting yourself into these jobs by asking around, asking nurses before you take the job, can I float? Like, can I shadow here? Shadowing is going to be your best friend. So honestly, like, just shadow on the unit. Do not take a job that seems unsafe. No matter how much money they are offering you, no matter how much you're worried, like, well, if I don't take this job, I'll never get another one, you will get another job. There are safe hospitals out there. There are safe units. Never take a job out of fear of the repercussions. Like, I am serious. If you are like, well, I need to get paid, I sort of wish in hindsight, that's why I took my job and the scary med surge unit, right? It did get me in the door to the hospital that I wanted. It ended up being okay, but and it wasn't even this unsafe, but I sort of wish I had just gotten a different job, because in my mind I was like, well, I just went to nursing school and I just graduated, so of course I need to get a nursing job. And I wish I had some, like, maybe just taken a quick different job, got a job at Target, something else that even though it wasn't going to pay me as much and wouldn't use my nursing skills quite yet, would bridge me to where I could get a nursing job that I actually liked. Like, it is just so important to find a unit that is safe, where you feel super duper valued, and respected that way. So the biggest thing is just finding a safe place. Beck Daniel, $30,000 sign on bonus. Ren, yes, sign on bonuses are never a good sign. Okay. I know everyone has them right now. So that makes it hard to weed through them, but sign on bonuses are frightening. Yeah, that's usually saying that why are you having to bribe people to work here is because you're not a great place to work for. All right, friends. Thank you for joining me today. I very much appreciate you. If there is anything that you would like me to cover like this, let me know. We have a couple things here. Um, like the video if you liked these things. That tells me and the Google gods that this is something you want to see more of, and it'll like shove it out so that the people who Google this hospital will see this instead. Let me know if there's anything you wish you could say but you can't because you work there, and I'll say it for you anonymously. Or if there's like a hospital or like a situation you've heard of, tag me on TikTok or Instagram or whatever. 3, we need a name for this series. Okay. We have had a few suggestions. But feel free to leave your suggestions down below, like of the series where I'm not super prepared, which sounds really bad, but more of like we're learning together. We have got healthcare hijinks. I'm going on Instagram and looking. Healthcare exposed. I kind of like that one. Um, health careless. Ooh, I like that one. The pizza party won't fix this. Okay, yeah. So let me know your thoughts down below. Or if you've worked at this hospital or you have thoughts, leave them down below. Comments. The YouTube gods also like those. If you're a member, I will see you over on our chat in just like 2 seconds. And yeah, have a beautiful rest of your day. Remember that you are not alone. You can do this. You're very capable. You can do hard things and you are enough. All right, friends, have a lovely day. Bye.